Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
Welcome to Remission Possible, the podcast dedicated to guiding and supporting you on your mission to achieve lower disease activity. I'm your host, Adam Kegley, Associate Director of Global Partnerships at the Global Healthy Living Foundation. We understand that this challenge wasn't something you asked for, but remember, you are stronger than you think, and you deserve the opportunity to regain control and live your best life. In today's episode, we'll hear from Natasha Trehan, a Canadian undergraduate student at the University of Ottawa and patient advocate for youth who lives with juvenile idiopathic arthritis. She is the founder of the podcast and organization called Take a Pain Check. With Natasha's leadership, Take a Pain Check is on a mission to empower youth and young adults with rheumatic disease through a wide array of programs, advocacy, and social media initiatives. We will be discussing Natasha's personal journey as a chronic condition patient, including how her life has changed since diagnosis, the importance of staying on treatment and shared decision-making between patient and healthcare professional, as well as the role self-advocacy plays in receiving better care, and how she defines and reaches remission in her daily life. So whether you're a patient in the early stages of your journey or someone looking for inspiration and motivation, this podcast is for you. So join us on this mission as we empower you with valuable insights and tips to break free from the cycle of pain and anxiety and ultimately bring you closer to achieving low disease activity. It's time to rewrite your story because remission is possible. Hi, Natasha. Thanks so much for joining us today and for being willing to share your story with us.
Thank you so much for having me, Adam. I'm really excited.
Great, me too. Well, if you'd like, we can get right into things and maybe you can tell us a bit about yourself, who you are, where you live, your profession, and student is also a profession, and the condition you live with.
For sure. So hi, I'm Natasha Trehan, like Adam mentioned before. I'm from Toronto, Ontario, originally in Canada. However, I do study at the University of Ottawa right now. I'm studying translational and molecular medicine, sort of like research, really research focused is what my program is all about. And I live with polyarticular juvenile idiopathic arthritis, and I was diagnosed when I was 13 years old. So it's been quite a while now. I am 21, so long journey.
Definitely a long journey. And I think we can just get right into that actually, because I wanted to talk a little bit about navigating treatment goals with you. And I know you have a lot of experience with this. And I know doctors often have specific treatment goals, but as patients, we might also have different priorities and different goals. And of course, some of those probably overlap as well. But I was wondering how you balance what your doctors aim for with your personal goals and preferences in managing your condition.
So in terms of my aim and my goals, it definitely takes time to come up with what my goals were. I think over time I realized my goals are not always the same as my doctor's goals, and I feel like a lot of patients can probably resonate with that. But I think as I grew up into adult care and transitioned, I realized I know what I want now, and I want to be able to do those regular activities that I could do in the past prior to my arthritis diagnosis. I want to be able to participate in activities where I can go out with my friends and not be in pain or handwrite or just do these different things. So those are my goals. My doctor's goals is like, what is the best medication I can be on to get rid of that inflammation as soon as possible? And although that is my goal, I realize that it'll take such a long time to get there. And so I think it's nice to have that balance, that conversation with my doctor. And so having questions written down has really helped me and allowed me to have those conversations with my doctor and balance that out. And then also just kind of mentioning that, for example, my doctor's really, really open. And I think one big example of how we kind of balanced both of our goals was when I recently switched to a biologic medication. Prior to that, I was on 3 medications at the same time. And so my doctor had mentioned that when you do switch to the biologic, it's important to keep at least one of those medications with the biologic. And so the one that she was recommending, I was like, I don't want to do that. I've had that all my life. I really don't want it. And she was like, okay, are you comfortable being on the other one? And I'm like, yeah, I'd rather be on the other one than this one. And so although she mentioned that that medication is most effective with the biologic, we came to that kind of consensus and conclusion that, it's important to see where the patient will be comfortable and kind of meet halfway. And I think that's what we did. And so that's where we kind of balance our goals. I was like, I don't want to take 2 injections every single week. I'd rather take a pill and an injection. And so that's how we kind of balance that for like optimal treatment. So yeah, that's sort of what we do. I think open conversations really help me balance that.
I think you actually answered my next question. I think it's so important just having that very open communication between you and your doctor. I think that's immensely helpful and important. And like you said, having that list of questions to where you're prepared, because the doctor's probably already prepared coming into the meeting, or at least we would hope. It's really important in terms of getting those goals together and aligning those. And I think, like I said, you kind of answered my next question, which was about shared decision making and how crucial that is for patients today, and including making sure that that's aligned with your own personal preferences. Like you said, you didn't necessarily want to be on a medication you'd been on your whole life and decided to switch it up, but aligning kind of your healthcare professional's goals with also your own goals and kind of meeting in the middle, I think, so to speak. How else has that kind of played a role in your treatment journey? And why do you think it's so important, shared decision making, that is?
Yeah, it's pretty interesting because I'm saying that now, but in the past, I've had a really rough time in terms of shared decision making. And I think shared decision making is something that both parties have to do. And if that's not being done on both sides, it's not going to work out. And at least for me in pediatric care, I feel like we're thrown with such big words, and it might also be in adult care. But personally for me, like I was initially diagnosed, I was scared. My parents were scared. We're all scared.
Of course.
And when you throw these big medical jargon and terminology at us, we just want to run. And so that's kind of what we did. And so it's interesting because I was on prednisone and methotrexate and that didn't really work. So the next step was a biologic. And this was, I think, 2 years after my diagnosis. And my parents were like, no, not for her, because they were Googling medication side effects and all these things. And they got scared. They got kind of put into Dr. Google, which I know is not the best thing to kind of go to. But when you don't have options and when you don't have comfortable conversations and shared decision making, that's where you go.
Right.
And so we went there. I mean, they went on Google and they were like, hey, she's not going to take it. And then my mom started Googling things, talking to people. Someone said, oh, Natasha, if you go to India, you can get treated there very well. And so we went there. I was off of medication for a year and we went there and nothing happened. We came back here and then I started a biologic because I feel like we needed to get scared. And we got scared because I got the x-ray results back and it was like, okay, she has damage in her joints. And my parents were like, okay, it's serious. Like, we need to get on medication. But I think we could have prevented that 1 year of not being on medication and trying out things. Like, I tried so many things, homeopathy, naturopathy, like everything. Nothing worked for me personally, but we tried everything because my parents were really like, let's try as much as we can so she doesn't go on that biologic. But what they didn't realize is how important it is to be on medication. I mean, now all of us know the importance of being on it, but I wish that conversation was very comfortable and there was an open space where we could talk about how we were feeling in that doctor's office so we could have been on medication as quick as possible.
Right.
But because we didn't have that shared decision making, my treatment progress kind of like went sideways. And I mean, now everything's better because we realize that, but it sucks because some patients have to be like, they have to kind of get hit with something and they're like, oh no, I need to be on it.
You also kind of touched upon, I think, the risks of, well, really you did talk about the risks of kind of not being on a medication that helps control your condition or that can help control your condition, or kind of, in other words, the risks of uncontrolled disease, essentially. And that clearly impacted your approach to treatment and to medication. And it also is completely linked, like you said, with shared decision making, because the other thing about, of course, being at the time underage is that your parents are also an integral part of your decision-making process. And even afterward into adulthood, caregivers are very commonly part of the shared decision-making process. And I think that's really important to highlight and to talk about. So I'm really glad you brought that up. I think in terms of talking a little bit more about those risks for if you're not on medication and making sure you adhere to a treatment, what else would you tell other patients about that importance of really being on an early and effective intervention and how that might factor in to the importance of shared decisions?
I think moving forward from kind of what I've learned over time is that I thought that it was my parents' job to take care of my health and learn about my condition. And that is so not true. I mean, it's definitely important for them to know because they live with me.
Sure.
But I think that I need to learn about my own condition. And so I think over time I started to learn about it, obviously, and we'll get into that. But being prepared was really important. So any symptoms that I experience, concerns that I experience, just keeping that written down somewhere. I think asking questions to your doctor is important. If you don't understand something, asking that can kind of prevent you going somewhere else and looking for answers somewhere else. And then expressing your goals and preferences. I know it's so hard because you may think that it's the doctor that makes all the decisions, but that shouldn't be the case because you are the one that's going to live with the condition. And so I think all those like little things have allowed me to realize if I'm not on top of it, I won't get my medication on time. I will have flares. I will have all these risks. And then sometimes even being on top of it can make you just tired and you don't want to take your medication. So finding that balance on like what are the best, easiest ways for you to be like on top of your medication, on top of your health is important because then you will want to take charge and you'll make sure that you're not kind of allowing those medication risks to happen to you.
And I think also being such an active participant in your own healthcare is so crucial, like you've said. I think one thing that sometimes people don't think about in that regard is that's actually advocating for yourself. That's becoming a self-advocate. And I was wondering, what do you say to convey your message there? How do you advocate for yourself with your own healthcare provider? And in that regard, maybe do you have some advice for patients to prepare themselves to be active participants in their own care? I know you said we've got to be on top of it. Is there anything you might want to elaborate on there, or what kind of knowledge or resources they should seek out?
For sure. I think at first it may be challenging to kind of want to start advocating for yourself. You're at a point when you're diagnosed where you're kind of in denial. I don't think you want to accept that you have this condition. And when you do accept it, you slowly realize that in order for you to thrive in the world and in the healthcare setting or just in any setting is that you need to learn how to know what you want, but then also say what you want, because you're only going to be able to get what you want if you say what you want and what you need. And so a couple ways that I learned how to do that. It was so rough in high school. My parents came, and this is not even in the healthcare setting, honestly, even in school, my parents came and sat with the school board and we discussed my accommodations for school. And looking at my parents advocate for me allowed me to understand how to advocate for myself. So I saw them in that room and I was there, but I didn't say much. I just said, this is what I need, but I felt like no one was listening to me. And so you have support systems that can help you learn how to advocate or be there with you when you need to advocate. I would definitely take advantage of that. And then, like I said, being an active participant in your healthcare, I think that means educating yourself, learning about your condition. And the way that I learned about my condition, I mean, my mom used to send me a PDF to read. I didn't read it because I was like, I'm not reading that. It was like 60 pages of what is JIA, all these things. I didn't like to read that. So I was like, no. And when I was 16, I got joint injections at the hospital for sick children and I got 10 of them. And it was so painful. But I realized that when I was getting those injections, there were also people coming to me asking for my blood, my saliva, all these different questions. I'm like, what are they going to do with my samples? Like, where are they putting this? And I asked questions and then I said, I want to know what they're doing with them. And then I got involved with that research recently. Actually, 2 years ago, I did research with the researcher who was in charge of that study where my blood and saliva was going, which was pretty interesting. But I found myself learning through research. So I got involved in research studies. I became a patient partner where I give advice on research studies related to arthritis. That's how I learned more about my condition. And honestly, you don't have to go that far. Simply looking at a podcast, listening to this, you're already learning a little bit about your condition or other types of arthritis. Finding the format that you want to learn is so important. I like learning by going to conferences and learning how to advocate for myself and getting that knowledge. So I think learning about the condition allows you to advocate. And then joining like support groups and patient communities, I think is so important because that gives you empowerment and kind of inspires you to want to advocate and talk about your condition. I know some people practice talking about their condition to a friend, and I think practice is important. So if you feel more comfortable kind of rehearsing what you're going to say before you say something, definitely do that. I think it's different for everyone. And for me, it was really learning how to advocate for myself. I mean, now I advocate through podcasts that I have and different things, but it's a journey. I didn't want to talk about it till grade 12, which was 5 years after my diagnosis. So I don't expect anyone to be like off the bat, yes, I'm going to advocate, although there are some people.
It's true. And that's so relatable, whether you're a young person that's been diagnosed or underage, or whether you're an adult, either later in life or midlife. It's so important to see how your community or the people that you love are actually advocating for you and to notice that. And if you're not ready, maybe they are. And you can learn a lot from that. And the other thing too, I think I pulled from what you were talking about in terms of the research. I think at the core of that, that's also super relatable for anyone because it's all about curiosity. It's all about the interest. Just having a little bit of curiosity goes a really long way. And I think that's so important to not only overall achieving your goals, but also like long-term management of your disease with a view toward getting toward remission or achieving low disease activity. And that can be really daunting. And I was wondering how you maintain hope and stay focused on your long-term goals. Can you share any strategies or mindsets that have helped you?
I think first realizing that it's important to set realistic goals. Oftentimes when we look at medication, we think that the medication is going to work so quickly, but that's so not true. It definitely takes a long time. And so I had to kind of change my mindset to be like, okay, the medication is going to take its own time. And while that's happening, what can I do on a daily basis to make sure that I'm okay and I'm able to do the things I need to do to get through my day? And so for me, an example of that is, for example, handwriting. And I use this example a lot because I think it's really impacted my life a lot. I think for some people it might be ridiculous to even hearing about this example, but for me, I had really swollen fingers and wrists, and my wrists were really swollen, and that kind of hindered my ability to handwrite. And so being in a science program, I mean, it was really rough. And I've had teachers and professors say, oh, we don't see the arthritis, so, you can handwrite, but that's not true because I was in pain. And so I realized, okay, maybe I need a wrist brace, or maybe I need a gel pad under my wrist, compression glove. I learned all these things through talking to other people with arthritis. But really getting those like daily pain management strategies, going to physio, OT, other people allowed me to change my mindset of thinking that, the swelling is going to go away in one day, which is not true. But like, how do I live my day-to-day life with being in like the most minimal pain ever? And so that's kind of what I did in terms of like understanding medication timelines. I think that's so important. And then focusing on the present, I think that also kind of goes through with everything I've been saying. And I've accepting that it's so uncertain. You don't know what's going to happen tomorrow. So going day by day. And then for me, in terms of strategies that have helped me otherwise, is joining a community. I think it's important to talk to other people that understand what you're going through.
That's exactly what I was going to say. It sounds like to me so much of also what the momentum that's helped you kind of achieve those goals is like surrounding yourself with the people that help you achieve those goals too. And I wondered like, how has engaging with the broader patient community and healthcare professionals through your organization, Take a Pain Check, how has that shaped your experience and your advocacy work?
Yeah, I think there's two main ways on how I got engaged with the community that helped me in general throughout my whole journey and my advocacy work. One being, like I mentioned, research. I mean, I realized that researchers actually care what patients think. There are positions on research teams where you can actually say, I don't agree with the symptom that you're researching, or I really think that this is so valuable for the patient community. So that's allowed me to realize that I have a voice in research. And staying up to date with that research and being on research teams has allowed me to feel more confident about what's happening in arthritis care because I feel like I'm also on top of what's happening too.
Great.
And so that has really helped me because I've met so many people, other patients, firstly, and then healthcare providers. And they've given me opportunities where I have now spoken at conferences and spoken at other events and been able to make different projects and work on different things. And then secondly, the organization that I started. So when I was diagnosed with arthritis, I think a big thing that a lot of young people, maybe a lot of people in general, feel is isolation. And for me, I didn't know other kids that had arthritis. And so that made things really hard just because I was diagnosed in grade 8 and then I didn't know who I could turn to who would really understand that. I think from what I remember, I was Googling kids get arthritis and I couldn't find anything or any support groups that I could join. I stumbled across one a couple of years later. I started talking to some people. I realized everyone has the same kind of concern. There's not enough awareness and advocacy when it comes to kids with arthritis. arthritis. I don't think that that's entirely true anymore now that I've been immersed in the field. But I think at that point, we were all like, yeah, there's nothing about us, all this stuff, because we couldn't find anything. Then I started a podcast. And I think that podcast that I started to take a pain check allowed me to talk about my arthritis. I learned that now I'm advocating for others. I took such a long time to learn how to advocate for myself in the school setting, healthcare setting, and I finally found myself ready to advocate for others, and that was when I started talking about my arthritis on the internet. I think that was like the biggest thing. And then I slowly turned it into a nonprofit that year in 2021, so I was going into my first year of university, because I realized that there's so many people that want to talk to other young people living with arthritis. So how do I make that community? How do I make programs? How do I allow people to become advocates, show them, how to become leaders, make them feel like their life is not over, make them feel inspired. And so for me, it was creating that nonprofit, Take a Pain Check Foundation. It is definitely another full-time job on top of school and medication. But I really enjoy it, and it's allowed me to advocate recently. I mean, I've been planning with some organizations, talking to government officials about some of the important work that needs to be done in terms of arthritis medications. Never in my life did I think I'd be doing any of this. So, I mean, all these different opportunities that have come my way have allowed me to become a stronger advocate, not only for myself, but for also other people.
I think that's so important, because the work that your organization is doing is so great, because there's always a lot of talk about people settling for feeling okay or I'm fine. And that's not necessarily something that's great, because it can really keep people from striving forward for better health outcomes. And there's plenty of reasons why, people just get bogged down. There's life, there's side effects from medications, there's pain, there's fatigue, there's anything and everything you could think of. So I think what I want to know from you then is, what should good look like to you? Can you share a bit what remission looks like for you personally, or low disease activity, and how you might distinguish that between therapeutic or medicated remission and non-medicated remission in your journey?
Yeah, so I think when you're on remission or like under remission, I think it's important to realize that you still need to get checkups and stuff. I think for me, it's like, okay, now I can finally not take that injection I have to take every week.
Right.
Or now I don't have to take those pills every single week. And like, I feel like if I'm under remission, I shouldn't be in pain. I shouldn't feel the inflammation and the swelling in my joints. I should be able to do those activities I used to be able to do without pain. So that would be the, non-medicated remission, medication-free life that I hope to achieve one day. But in terms of medicated remission, I have been on medicated remission for, I think, 2 years.
Congratulations.
Thank you. I mean, it's over now, but it was nice during that time. But I think for that in particular, you get so excited because you're in not that much pain anymore. You can do the activities you want to do, but you're still taking the medication. It's so important to realize, though, that your life can change and like any day can switch up on you. And I personally didn't think that. I mean, I was on that medication for multiple years.
Right.
And I was thinking, okay, like soon I'll be able to get off of it. But no, I started experiencing the morning stiffness again, the pain, the inflammation, not being able to do the things I could do so quickly. And it was something I didn't expect at all. And so really, I think it's important when you do think about remission is like, think about the goals that you have for yourself in terms of your pain journey and your condition. So for me, that looks like being able to do the things I used to be able to do without being in pain, not being on medication, but checking in with my doctor because it can come back so quickly.
Exactly. Thank you so much. And I think, as we wrap up, as a fellow patient, I would just want to ask you, what are 3 words you would share with all the listeners with chronic conditions, especially those who might be in the early stages of their journey, just to support them in continuing onward to seek the best possible treatment?
I would say educate, advocate, and persevere. And just because I think those 3 words really resonate with me, I think especially those 3 words because things get better. For me, I never thought things would get better. You always think the worst, but it's so not true. Looking back, like 8 years ago, I would never have thought that I'd be even talking to you about my arthritis journey. And so, yeah, those are the 3 words that I would say: educate, advocate, and persevere, and things get better.
Thank you. I think that's perfect because it really sums up perfectly everything that you've been talking about, which I think also really comes back to those ideas of curiosity and surrounding yourself with the community and the caregivers that that are there to help you along your journey, you know, whether you're ready to advocate or not. And they're going to be there alongside you to educate, to advocate, and to really persevere, you know, right there with you. And then that way you're able to do that as well. So I just wanted to say thank you so much for joining us, Natasha. I really, really appreciate it.
Thank you for having me.
Thank you for joining us on Remission Possible, the podcast where we explore the path to low disease activity and improved well-being. We hope the stories, insights, and guidance we've shared have inspired and empowered you along the way. This podcast was made possible with support from AbbVie. If you like what you've heard, be sure to rate our podcast, write a positive review, and spread the word by sharing with your family and friends. It'll help more people like you find us.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.